Let's begin with our top story coming in from the United Kingdom, as depression rate in the UK has now doubled during the COVID-19 pandemic. According to official data, 19% of adults reported some form of depression during June, compared with 10% in the 9 months to March 2020. Stress and anxiety were the most common types of depression listed by people. Data also shows that women, differently abled as well as jobless people were most likely to experience some form of depression. The data raises concerns over the toll that the pandemic has been taking on people's mental health. The crisis has also increased the pressure on Britain's public health system, which has been trying to cope with a high coronavirus mortality rate. For more details, let's quickly go across to our London Bureau Chief, Mandy Clark, who's joining me live at this hour from London. Mandy, a very warm welcome to you. Now, let me clearly ask you, the coronavirus pandemic has not only impacted the population at a physical level, but a mental level too. What are the factors that have led to a rise in depression in the UK, and which age group has been most severely impacted?
Yeah, it's almost an invisible crisis, the level of depression that is happening. And it is the groups that are most vulnerable. So we're seeing differently abled peoples, women. It's also very much linked to the economy. So suddenly if they found that they just were in debt by £1,000, that caused a lot of stress and anxiety that led to depression. These are people probably on a more vulnerable job position, and that's also linked to the economy. And we also had other reports that domestic abuse skyrocketed during this time. They would be vulnerable in their own homes, and 999 received calls about domestic abuse, one every minute. So it is an invisible crisis that that is just another layer of the corona pandemic.
Right, it is an invisible crisis, and very rightly mentioned by you that it's not just depression, it is also domestic abuse which has been on the rise. Mandy, how is the government expected to cope with the pressure on Britain's public health system, which has already been coping with a high coronavirus mortality rate?
The government hasn't come out with plans just yet, but certainly it has been on the cards, and there has been a lot of discussion about these hidden pressures. They have done a lot of the furlough scheme to avoid that economic impact that is almost a secondary factor that's leading to this stress and anxiety. But we are expecting increased funding in the NHS for those support systems, because it's not just the immediate crisis and the acute wards that need to be beefed up, but the support systems that deal with mental health throughout the population.
Right. Let's hope that that increase in funding happens as quickly as possible. For now, thank you so much, Mandy Clark, for bringing us those details.